Hi, my name is Michael Mead. I serve as a senior fellow at NORC at the University of Chicago and as director of research and programs for the East Tennessee State University Center for Rural Health Research. We are going to be talking to you about declining rates of overdose mortality in Eastern Kentucky. This work comes from our opioid misuse community assessment tool. This was a tool we developed for USDA that allows you to look at overdose mortality rates across the United States using heat mapping. So the tool allows you to overlay social and we are showing mining and natural resource, and you see that correlation between mining and overdose mortality. And it allows you to compare data across 5-year time periods. So you can see that that mining has actually decreased throughout this region. And you see some of those associations with overdose mortality as declining rates of mining have occurred. One of my favorite parts about the tool is that it allows you to access county level data. In this example, we have Clay County, Kentucky, and you can pull your county data, compare it to your state and to the nation. And you can also compare across 5-year time periods. And in this case, we can see that the overdose mortality rates in Clay County have gone down 41 per 100,000 over those time periods, comparing 2010 to 2014 to 2015 to 2019. And this basically shows that nationally. And you can see nationally across the nation, overdose mortality rates have gone up. The nation as a whole has gotten a darker shade of blue. However, within Eastern Kentucky, and this is really what drew us to the study, within Eastern Kentucky, we actually see very rapid declining overdose mortality rates, unique from what we see in the rest of the nation. So this led us to do a qualitative study for the Centers for Disease Control and Prevention to really understand what was driving those declining overdose mortality rates throughout Eastern Kentucky, again, unique from what we see in the rest of the nation. This basically shows that map in a different way. So the darker green here are the counties with the steepest decline in overdose mortality. Darkest orange have the steepest increase. And again, you see that unique decline in Eastern Kentucky. And this also shows it another way using line graphs. Over time, you can see that even as rates have continued to increase in Ohio and West Virginia, they went down around 2011 in Kentucky and have remained relatively stable. And this shows the counties that we were looking at. So these are 8 counties in Eastern Kentucky. And interestingly, of the 10 counties across the entire United States with the steepest decline in overdose mortality, these eight are located in Eastern Kentucky. So we, again, were looking at what was contributing to those declines. We heard a lot about policies, programs, and intervention, ranging from prescriber behavior to access to treatment to increasing naloxone distribution and others. And this is just one of the quotes from our study, really looking at the impact of Medicaid expansion. What we heard was that Medicaid expansion really made a tremendous difference in increasing access to treatment across Eastern Kentucky, and treatment really exploded throughout the region due to Medicaid expansion. We also heard about community environmental factors in the Appalachian region, but there were other factors as well. Ultimately, everyone is at the table now. This is another one of our quotes, and it's not just one agency's problem. Everyone is working together to try to address this issue together. And then finally, we do know that there are reasons that also may be contributing to the decrease that we observe. One of those is methamphetamine. Methamphetamine typically does not lead to fatal overdose. So as people shift from opioids to methamphetamine, we also see declining overdose mortality rates. However, and this is really a very important point to end on, however, we also know that due to the COVID-19 pandemic, rates are increasing nationally and in Kentucky. During the pandemic, rates have actually increased in Kentucky 50%, and the region needs to really redouble efforts to regain the ground that's been lost during the pandemic. And this really shows finally what we see in terms of the economic impact. This is from a study we did for the Appalachian Regional Commission, and you see that the 25 to 44-year age group are the people who are most impacted. These are people in their prime working years. That's why this has such an impact on our rural economies. This is showing males, but we also see this in females. And then thank you again for letting us do this presentation. My contact information is on this slide, and we would be happy if anybody wanted additional information.